Are you a college student who's feeling depressed? If so, there are some things that you should know. Today we'll be talking about antidepressants, specifically selective serotonin reuptake inhibitors. Did you know that antidepressants are the most commonly prescribed drug in America? And although these pills are legal, there can be some very bad side effects if not taken properly and under a doctor's care. College students should first understand SSRIs and the potential side effects that can occur in normal use and also in abuse of the product. Let's now take a closer look at these SSRIs and how they work.
The brain plays an important role in regulating numerous human functions. In order to properly do its job, the brain must communicate between its cells, which are also known as neurons. In a typical brain, neurons send signals between themselves at a location called the synapse. An electrical signal travels down one neuron, and then, at the end, it triggers the release of specific molecules. These molecules are released into the synapse where they bind to the next cell, causing the original electrical signal to either be carried further along into the brain or to be terminated. Once the molecules have done their job, they release from the receptors on the postsynaptic cell and are taken up into the first neuron where they came. In the case of SSRIs, the molecule in question is called serotonin. Rapid reuptake of serotonin can result in insufficient levels of molecule in the synapse. For this reason, SSRIs can be taken, as they effectively block the reuptake of the serotonin at the presynaptic neuron. In doing so, SSRIs help to combat the condition of depression, which occurs when the brain cannot effectively communicate properly between its neurons.
Like we said earlier, SSRIs block the reuptake of serotonin, raising the levels in the brain to help decrease the feelings of depression. SSRIs may take around 2 to 4 weeks to raise the levels of serotonin in the brain, and the treatment benefits may not be seen for a month or so. Once serotonin levels are raised, however, mood is usually improved. SSRIs only cure the symptoms of depression. They fail to address and cure the underlying causes of depression, which can actually be quite complex. Here's some side effects of SSRIs. They can cause nausea, headache, insomnia, dizziness, changes in appetite, weight fluctuations, mania, and even sometimes increased feelings of depression. They can have some dependence effects, mostly withdrawal symptoms. Could be related to increased suicide risk in children and adolescents, though that hasn't really been proven. It may take weeks of treatment, and there are some studies that say this can cause changes to neuronal cells in the hippocampus of the brain, changing cell plasticity and actually increasing anxiety. SSRIs have little potential for abuse, but since they can cause decreased appetite and weight loss in some people, this could be a go-to drug for people wanting to lose weight or for people who are anorexic. Also, pairing SSRIs with other things like beer can cause a person to get a high and have increased energy and mood elevation. High doses of SSRIs can cause an amphetamine-like high, and this could also cause a potential for abuse. Overall, the benefits of SSRIs seem to outweigh the adverse side effects and the small potential for abuse.
Although there are some great benefits to taking antidepressants and SSRIs specifically, they should still be taken with caution. Always consult a doctor to find out what's best form of treatment for you and your specific needs. And in addition, remember that there are lots of resources available on campus at Michigan State University.